Depressive disorder is a serious mental health condition that affects how a person thinks, feels, and function on a daily basis. It is marked by symptoms such as persistent sadness, fatigue, loss of interest, and hopelessness. It is also one of the most common psychiatric disorders worldwide. Over 280 million people live with depression globally. It can lead to academic struggles, relationship issues, and even job loss. Yet, it is often misunderstood because the symptoms are invisible. That's why awareness and early support are so important.
So I'm going to talk about historical background of depressive disorder. So as we all know, depression have existed since a long time ago. The concept of depressive disorders has evolved from ancient views of melancholia, often linked to imbalance of bodily fluids or spiritual influences, to the modern understanding of depression as a complex mental illness influenced by biological, psychological, and social factors. Early inspiration often intertwined spiritual and medical explanation, while later psychological theories gained prominence. Modern diagnostic systems like DSM and ICD have helped standardize the classification and understanding of depressive disorder. To debates continue regarding the context of depressive symptoms and their relationship to adaptive responses like grief. Melancholia came from Greek ancient. For Roman physician Galen supported the humoral therapy for depressive disorder, but Islamic scholars like Ibn Sina wrote about depression and recommended treatments like music therapy and behavioral therapy. For ancient Mesopotamians and Egyptians used religious or magical treatments. By Middle Ages, 5th to 15th century, depression was seen as a moral or religious failure. They used exorcisms, prayer, and punishment as treatment because they see depression as a sin. Renaissance to Enlightenment century, 15th to 18th century, the renewed interest in scientific explanations. Physicians began exploiting psychological and biological causes. Depression still often misunderstood as melancholy temperament. By 19th century, they start to psychiatry's rise as a medical field. Depression studied under the terms like neurasthenia or nervous breakdown. Treatments included rest cures, early forms of psychotherapy, and institutionalization. Early 20th century, Freud linked depression to unresolved grief or internal conflicts. Psychoanalysis became a common treatment. First attempts to classify mental disorders emerged. Mid 20th century, 1950s to 1970s, discovery of antidepressant medication such as NAOI or tricyclics. Depression began to be seen as a biological disorder involving brain chemistry. Late 20th century to present, introduction of SSRIs such as Prozac and other modern treatments. DSM-3 1980 established major depressive disorder as a specific diagnosis. Growing use of cognitive behavioral (CBT) and holistic approaches. Awareness and destigmatization efforts have increased globally.
Julia is a young woman who began experiencing depressive symptoms during her teenage years. She shares her story to raise awareness about mental health struggles in youth. Her symptoms included persistent sadness, negative self-thought, sleeping problems, and loss of interest in daily life. She often felt fatigued and isolated, withdrawing from her social circle. Julia's experience shows how depression can slowly take over someone's emotional and physical well-being, even if they appear fine on the outside. Depression had a major impact on Julia's daily life. She struggled to wake up in the morning, skipped her school, and lost interest in activities she once enjoyed. Her academic performance declined and she felt disconnected from her goals and future. At home, she became distant with her family and her friendship faded as she withdrew. Emotionally, she felt numb and overwhelmed, often believing she was a burden. Her story shows how depression can affect every part of a person's life, mentally, socially, and academically.
I'm going to present case study 2, which is about Lawrence, a psychiatric nurse. Even though Lawrence works in the mental health field and has professional knowledge, he still failed to realize he was falling into depression. This was his first time going through something like this. He had never had such an emotional breakdown before. So when it started, his mood changed. He had a persistent low mood and felt emotionally dull, like he couldn't feel anything clearly. He also lost interest in things he used to enjoy. Physically, he felt extremely tired all the time, even like small tasks felt exhausting. He also had trouble sleeping, which made him feel worse. And mentally, he experienced negative thoughts and had a hard time focusing. He often blamed himself for feeling this way, but at the same time, he kept denying it. So at first, he didn't believe he was really sick. He kept thinking, I should be able to get over this. So his symptoms slowly started to affect different parts of his life. At work, he couldn't function well. His mental state made it hard for him to do his job properly. And as a healthcare worker, he began to doubt himself and felt confused about his role. Socially, he pulled away from people. He didn't want to talk to anyone and started avoiding social situations. He felt more and more isolated. And the turning point came when his co-workers and family members noticed something was wrong. The reminders helped him see that this wasn't just stress, it was something more serious. So with their support, Lawrence finally found the courage to seek help. He began psychotherapy and also took medication. Through this process, he learned that recognizing the need for help is not a weakness, it's actually a sign of courage. So in this case, we see that even someone with mental health training can miss the signs in themselves. Lauren's story reminds us how important it is to listen to those around us and to take that first step when something doesn't feel right. Now let's take a look at both cases together and see what they have in common as well as how they're different. So starting with the similarities, both Lawrence and Julia experienced depression with symptoms that lasted over a period of time. This wasn't just a bad day or a passing mood. It really affected their daily lives. They both felt low almost every day and things that used to make them happy just didn't feel meaningful anymore. And mentally they were caught in negative thinking. They struggled a lot with self-worth and for a long time didn't realize or they didn't want to admit how badly they were doing inside. And physically they felt drained. Both had very low energy and sleep issues that made it even harder to function. Socially, both of them started pulling away. They didn't want to talk to family or friends and slowly isolated themselves, which sadly made things feel even worse. And even the most basic tasks like getting out of bed, eating, or going to school or work became hard. And I think that's something people often underestimate when it comes to depression. But thankfully, both of them eventually reached out for help. With therapy and support from people around them, they started recovering and slowly began to feel better. And now moving on to the differences between them in terms of age and gender. Lawrence is an adult male, while Julia is a teenage girl. That already gives them very different life stages and experiences. And their backgrounds also shape how they saw their situation. Lawrence works in the mental health field. He's a psychiatric nurse, so we might expect that he noticed the signs early, but actually he missed them in himself. Julia is just a student and didn't have much knowledge about mental health when her symptoms first appeared, so for her everything felt unfamiliar and confusing. Their initial reactions were also different. Lawrence went into denial. He kept telling himself that he should be able to handle it on his own, maybe because of his role as a healthcare worker. Julia, meanwhile, wasn't in denial. She knew something was wrong, but she didn't know what to do about it or how to cope. The impact on their daily responsibilities also show up differently. For Lawrence, it affected his work performance and made him question his identity in his job. For Julia, it showed up in school. She skipped classes, her grades dropped, and she lost her sense of direction in life. Their social reactions also had a slightly different pattern. Lawrence became distant, but he still had people around him, like co-workers, who noticed and reached out. Julia, on the other hand, completely shut down socially. She avoided her friends and stopped replying to messages, which made her feel even more alone. As for support during recovery, both of them received help, but through slightly different channels. Lawrence only sought help after his co-workers and family pushed him to do so. He then went through therapy and took medication. Julia also received treatment, and with her family support, she slowly started rebuilding her life and setting new goals. Finally, in terms of the recovery focus, Lawrence's journey highlighted how important it is to realize that asking for help is not a weakness. It takes real courage. And Julia's story was more about learning how to manage her emotions and finding a new direction in life, one step at a time. So even though they're very different people, different in age, background, and even how they reacted at first, their stories both show us the deep impact depression can have. And more importantly, they show us that recovery is possible, especially when there's support, self-awareness, and the willingness to take that first step toward healing.
Effects of depression on our emotional, physical, social, and long terms. For emotional effects, depression can cause persistent feelings of sadness, emptiness, and hopelessness, irritability, or increased sensitivity to rejection or criticism, loss of interest or pleasure in activities that we once enjoy, which is called as anhedonia, feels worthless, cute, and self-blame, difficulty in concentrating, making decisions, or remembering things, having thoughts of self-harm, death, and suicide, lasting sadness, emptiness, hopelessness, or guilt that lingers and affect you day to day. Depression can interfere with your everyday activities, but it can ultimately make you feel lonely too. In children, depression can cause clinginess and a refusal to go to school. For example, we enjoy things like watching movies, but suddenly we doesn't feel like we like things anymore. Anything we do, even trying new things like gaming or anything else, doesn't make us feel anything at all. Not happy, not sad, just nothing. As an example, when something's go wrong, we will quickly blame ourselves for that bad things, even though it's not our fault at all. Depression messes with our head and makes us have trouble with our memories and decisions. Cognitive changes, such as trouble remembering things or difficulties with making decisions. Some also have difficulty to concentrate and remembering things. Depression may cause self-harm, preoccupation with hurting oneself. It can also increase the risk of suicide. Some people with depression show significant changes in areas of the brain like frontal lobe, hippocampus, temporal lobe, and amygdala. While physical effects on our body is we will feel fatigue and low energy even after resting for a long time. Changes in appetite, which we can eat too much or too little. having insomnia or hypersomnia, itches and pain outside and inside our body, digestive issues, weakened immune system, which can lead to more frequent illness. People with depression may experience appetite changes, which can lead to weight gain or loss gain. Medical experts associate excessive weight gain with many health issues, including diabetes and heart disease. If a person's body weight is too low, it can harm the heart, affect fertility, and cause fatigue. Insomnia is trouble sleeping. These two can lead to feeling exhausted and make it difficult to manage both your physical and mental health. Doctors link sleep deprivation to a host of health problems. Insomnia may cause our brain to stop overthinking things, even the smaller things that happen. We also can suddenly start to think about what has happened in the past and begin to judge ourselves all over again. Similarly, research has correlated long-term sleep deprivation with high blood pressure, diabetes, weight-related issues, and some types of cancer. People with depression may also experience unexplained aches or pains, including joint or muscle pain, wrist tenderness, and headaches. Depression may be an inventory risk factor for health problems. Mental health conditions like depression can affect heart function in various ways, including by increasing blood pressure and heart rate. It can also reduce a person's motivation to maintain healthy habits. An unhealthy diet and a sedentary lifestyle can increase the risk of heart disease, such as problem with kidney, problem with our nervous system. We can have a cramps in our back, our leg, or even our stomach, and we can also have a malnutrition. It can also cause inflammation and may change the immune system. Some research suggests that depression could be due to chronic inflammation. Depression more likely to have inflammation condition or autoimmune disorders such as irritable bowel syndrome (IBS), type 2 diabetes, and arthritis. Often report stomach or other digestive problems such as diarrhea, vomiting, nausea, and constipation. For social effects, we may start to begin withdrawal ourselves from family and friends, reduced performance at work, school, and even daily tasks, loss of interest in social activities or hobbies, strained relationship due to mood swings and lack of communication, isolation and feelings of loneliness. When we have depression, we automatically start to self-isolate ourselves from everyone and everything around us. Difficulty in maintaining responsibilities such as parenting or household tasks. For long-term effects on a person with depression disorders, they will have chronic health problems due to stress and inactivity, increased risk of substances abuse such as alcohol and recreational drugs, impaired brain function, especially memory and attention, persistent low self-esteem and loss of motivation, long-lasting impact on career, education, financial stability, and lifestyle. Recurrent depressive episodes or development of other mental health disorder such as anxiety, post-traumatic stress disorder (PTSD), eating disorder (ADHD), personality disorder, bipolar, schizophrenia, and other mental health disorder might occur to the person with depression, mental health.
Hey everyone, Damien here. So there are 8 symptoms that caused by a depressive disorder. First, feeling sad and lonely. Second, losing interest on the activities they enjoyed before. Third, they does not have appetite to eat food. For example, they may eat more than before or less than before. Fourth, they cannot sleep well. They used to get up in the middle of the night and start grumbling and thinking. And fifth, they want, which is the important, they wanted to hurt themselves by committing suicide. Number 6, difficulty thinking, cannot concentrating, forgetfulness, or difficult by doing a minor decision. Number 7, they're feeling guiltiness and worthless in whatever they're doing. And lastly, they overthink so much. So, there are 3 ways to overcome depressive disorder. First, psychological. By going to a psychological, they can help you by combining with antidepressant medication in moderate and severe depression. Antidepressant medication are not needed for mild depression. Psychological treatment can teach new ways of thinking, coping, and relating to others. They may include talk therapy with professional and supervised lay therapies. Talk therapies can happen in a person or online. Psychological treatment may be accessed through self-help and menu, website, and apps. Second is biological treatment. Brain stimulation therapy. Brain stimulation therapy can help people who have severe depression with psychosis. Types of brain stimulation therapy include electrostimulative therapy (ECT), transcranial magnetic stimulation (TMS), and vagus nerve stimulation (VNS). By this treatment, patients slowly will become more effective than before because they can feel and that confidence are building in them. Lastly, which the causeless is lifestyle. By changing lifestyle also work to treat depression, but it may take time compared to biological and psychological. For example, whenever you feel alone, try to do the things which you enjoy the most, like sports, activities. Okay. So second, when you don't like you want to speak to someone who in need, you may also go to someone that you are close with, for example to parents, and tell your feeling. Third, you can also exercise yourself by going to gym. By doing that, you may feel that your muscle is growing when you look into mirror. By that, it gives you the confidence whenever you go, no matter you're in the competition or you're in school activities, no matter what happens, you may feel confidence in every situation.
To conclude, depression is a common but serious mental health condition that affects millions of people worldwide. The early signs are often missed, which can delay the treatment and support. Depression doesn't discriminate. It can impact anyone regardless of age or background. But the good news is recovery is possible with the right help. And real stories like Julia's and Lawrence remind us how important it is to listen, understand, and talk openly about mental health.